Diabetes is a condition that causes blood sugar levels, also called blood glucose levels, to rise higher than normal. This is called hyperglycemia. When you eat, your body breaks food down into glucose and sends it into the blood. Insulin, a hormone made in your pancreas, helps move the glucose from your blood into your cells so that it can be used as fuel for energy. In type 2 diabetes, your body has trouble using the insulin that it makes. This is called insulin resistance. At first, your pancreas makes more insulin to make up for this, but over time it isn't able to keep up and the blood sugars remain high. When blood sugar levels stay high, you are at a higher risk for heart disease, kidney disease, blindness, and nerve pain. There are several factors that increase your risk for developing type 2 diabetes, including being overweight, having high blood pressure, not being physically active, being 45 years of age or older, or having a parent or sibling with diabetes. The goal of treatment is to help you feel good and prevent long-term problems. To meet these goals, your healthcare team will work with you to create a care plan that includes lifestyle changes and medications. Having a healthy eating plan will help you meet your needs and reach your goals. What you eat, how much you eat, and when you eat are all important. Staying physically active and taking your medications as prescribed by your doctor are necessary components to your care plan. When you find out you have diabetes, the first thing you may think about is your physical health. However, caring for your mental health is equally important. Being diagnosed with diabetes can come as a shock and set off a variety of emotions such as fear, denial, and anger. Learn as much as you can. Ask questions and make sure you get answers that you can understand. Knowledge is powerful and can improve your confidence to succeed in managing diabetes. Set realistic goals and don't try to make too many changes at once. Focus on things you can control, like making healthy food choices, being active, and getting enough sleep. Diabetes can be difficult to live with. The day-to-day management can become overwhelming and lead to distress or burnout. Be aware of the signs of distress, such as frustration, lack of motivation, feeling defeated, and wanting to give up. Distress is common, but remember that nobody is perfect at managing diabetes. Don't be afraid to ask for help. Don't beat yourself up if you eat more than you planned or couldn't exercise. You don't have to be perfect to keep blood sugar levels in your target range. You may ask, why me? Anxiety and depression are common and should not be ignored. Feeling blue is normal. However, loss of enjoyment in your favorite interests, having difficulty sleeping, and feeling hopeless are all signs of depression. Let your healthcare provider know if you experience these symptoms for more than 2 weeks. Diabetes is easier to manage when you don't feel alone. Reach out to family members for emotional support. Talk to your healthcare team about things that are getting in your way of succeeding, such as transportation or trouble paying for medications. Consider a support group. Talking about how you feel and learning from others who share your experiences can be very valuable. Sometimes, meal planning, weight loss, and exercise are not enough to keep your blood glucose in a healthy range. The next step may be to add medication, and your doctor will decide which one is for you. It's important to know the basics of your medication, such as the generic and brand names, the prescribed dose, the time of day and or number of times per day that you should take the medication, whether or not you should take it on an empty stomach or with meals, if you should avoid alcohol while taking the medication, if there are any foods you need to avoid, side effects you should watch out for, and how to store the medication. Keep a copy of your medications in a place you can easily find. It's a good idea to give a copy to a friend or family member as well. Be sure to tell all your doctors about the medications you are taking and use the same pharmacy so all your information is in one place and interactions between medications can be minimized. Not taking your medications as your doctor has prescribed may affect your health and even be dangerous. Do not adjust your medication on your own. Talk to your doctor about possible changes that may help reduce any obstacles that are keeping you from taking your medications as prescribed. As always, Please talk with your healthcare team if you have any concerns about how to manage your diabetes so you can lead a healthful life. For more educational information, please reach out to Bethesda Nutrition and Wellness Solutions.